If you're here and you're looking for the Anesthesia and Senior Dogs webinar, you're in the right place. We're just going to give a moment for a couple more people to join in, and then we'll begin. Well, while everybody's joining in, I'll introduce myself and then we'll get on to our special guest for today. I am the honored board president of the Gray Muzzle organization. My name is Denise Fleck, and I've also been proud dog mom to 13 dogs over the years, 7 of which were adopted as senior dogs, with one of those, our 10 years young Akita Wish, having just been adopted earlier this week. But having taken care of so many gray muzzled pups through their golden years and getting closer to seniorhood myself, I know things start to hurt and they don't work the way they used to. And sometimes they even shut down. So we really need to manage these conditions to maintain comfort and a good quality of life for our senior dogs. They are our best friends after all. When our senior dogs sometimes then have heart conditions or kidney disease, that can complicate the use of anesthesia, whether they need dental cleanings or mask removals or whatever kind of procedure they need to have done. So it's so important that we really work with our veterinary team. After all, I always consider our veterinarians our pet's second best friend. We should be there first, but I always think of them as their second best friend because they really are our support team, as well as our advice and wisdom people that help us get through those more difficult times with our older dogs. So in today's webinar, Dr. Nicole Trenholme is going to discuss anesthesia for a variety of procedures, like I mentioned, whether it be a dental cleaning. And we all know so many people just don't want to deal with the teeth when pets get older because they think about why put them through that. But getting rid of that bacteria and pain, I mean, most of us don't deal with a toothache, so why should our older pets? But being able to work with the vet team to make them more comfortable and addressing their concerns, regarding anesthesia is just so very important. So we are pleased to have Dr. Nicole Trenholme here with us today. She is currently the medical director at Evolution Veterinary Specialists in Lakewood, Colorado. She's double boarded in small animal emergency critical care and veterinary anesthesia and pain management. Nicole is a graduate, or I should say Dr. Nicole is a graduate of Ross University School of Veterinary Medicine. She did her clinical year at North Carolina State and one of her internships at Friendship Hospital for Animals in Washington, D.C. She's been all over the country, it looks like. She then returned to North Carolina State for a specialty internship in small animal emergency critical care. Her small animal emergency critical care residency and master's was done at the University of Missouri, and anesthesia residency at the University of Georgia. Go Bulldogs, since I'm outside the Atlanta area now. Was an assistant professor at the University of Illinois before starting the critical care, anesthesia, and emergency specialty services where she is now at Evolution Veterinary Specialists. So we are, as a team at Gray Muzzle, we are so honored to have Dr. Nicole Trenholme with us today. Please go ahead and put your questions in the chat box at any time, but we will hold them till the end of her presentation and we will answer as many as we can. Thank you for being here and wanting to learn how to better care for your senior dogs. I'm now turning it over to Dr. Trenholme.
Thank you so much, Denise. And thank you guys for joining me today. One of the things I do in my current position is I actually will meet with owners that are concerned about anesthesia on their pets, whether they're old or just have multiple health conditions that they're concerned about, and talk them through the anesthetic event and kind of what things we watch for, how we're going to combat different things. So I kind of based this talk on the things that I might try to discuss with owners. I'm a very big proponent of trying to let you guys know a little bit of the science behind it so that you know kind of why we might have different thought processes. So kind of our objectives going through today are going to start out just reviewing general recommendations of what we might want you to consider doing in the pre-anesthetic period for a dental mass removal or more major surgery. And then discuss some of the common disease processes in our older dog and cat patients. So that includes cardiovascular disease, kidney disease, blood pressure challenges, and some hormonal things as well. And then kind of at the last little bit, just review some things that as their family you can do to try to help make the anesthetic event go as well as possible. And usually that has to do with medications. So starting out thinking about what things we might recommend for an anesthetic workup, one of the first things you're going to see that your family vet, or if you're at a specialty hospital, the veterinary specialist is going to do is going to talk to you about the history of your family friend. So is your dog or cat eating the appropriate amount? Has there been any recent change in how much water they're taking in? Have you noticed anything different about them? Because I always am a proponent of age is not a disease. We just collect more challenging things to deal with. And so history is really important. So if you notice something in day-to-day life with your four-legged friend, definitely let your veterinarian know about that. Then always we do a thorough physical exam. So looking at respiratory rate and effort, especially with older dogs, they do tend to get heart disease. And we'll talk a little bit more about what that can do for altering breathing. And so watching for their respiratory rate and effort changes during that physical exam, you'll see that we listen to the heart, we listen to the lungs with a stethoscope. We feel their pulses, get a body temperature, all their vitals, and just do a good thorough physical exam to make sure we're addressing the things that we need to. I'm about to show a video that's a little bit more of an extreme example. It's actually a dog that's working a little bit more to breathe because they are in congestive heart failure. So this is a little friend who was in heart failure. And so it's something that when dogs are working to breathe, sorry, it's being a little bit splotchy all of a sudden, but they'll have a little bit more effort with their breathing. They might open mouth breathe and just be really focused on the actual breathing. And so if we ever see that, if it's an elective procedure, we're not going to anesthetize that patient. We need to get them more stable first before we have them undergo anesthesia. So I do apologize. It's a little bit having a time delay that it didn't have earlier. We might also recommend diagnostics. And so that could be x-rays of the chest to look at the heart size, look at the lung itself for any changes. We might recommend that you go see a cardiologist to get an ultrasound of the heart, something called an echo. And that allows for us to look at the structure of the heart and make sure that if there's any new murmurs noted on physical exam, that it's not something more significant that needs intervention ahead of time. We might get a blood pressure. We might look at some cardiac enzymes, which I'll go over a little bit more, like troponin or proBNP. And then we might look under the surface just with full lab work. So doing a complete blood count to look at white blood cells, red blood cells, and platelets. Look at liver and kidney function with a chemistry panel, also electrolytes, and then look at the urine to make sure that they're able to concentrate their urine, make sure there's no UTI we need to address ahead of time, anything like that. Some more specialized tests that we might do is like a screening. If there's a patient that has like a new heart murmur, would be something called a BNP. And so what this is basically if the heart stretches, this substance is released into the blood and then excreted in the kidneys. So we can do a simple blood test to screen for heart disease. If this is elevated, then we're more likely to recommend an ultrasound of the heart to look for structural disease. Similarly, there's something called a troponin level, which is another cardiac enzyme that if the heart muscle itself is damaged or is not getting enough blood flow to it, then troponin can be elevated. So those can be screening tests that can be done at your family vet to send out to see, is there something that I need to be more concerned about heart disease and look into doing an echo or something else. When patients with any sort of comorbidities, so heart disease, renal disease, and others are under anesthesia, we keep them on IV fluids, but we have to tailor it to their needs. So if they have severe heart disease, they can't tolerate a whole lot of IV fluids to stay hydrated. But if they have renal disease, they might need fluids a little bit longer. And so you might have your vet talk to you about before, like a dental on your cat that has chronic kidney disease, having them in hospital a little bit ahead of time to start some IV fluids to make sure they're well hydrated. Any of our patients, when they're under anesthesia, we recommend doing full monitoring. And so we'll look at their heart rate and rhythm with an EKG. We watch their ventilation and breathing with oxygenation with a pulse ox, and use something called a capnograph to watch to make sure that they're breathing off the appropriate amount of carbon dioxide. We watch their temperature and their anesthetic depth. And so all of these are things that we do on all patients, but I make sure are especially important in our patients that have multiple things going on with them. And so now we're going to kind of transition into some of the more common disease processes, starting out with the cardiovascular system. And so I do think it's important to understand a little bit about normal anatomy. And luckily, their heart is very similar to our heart. So it does have 4 chambers. So there are 2 atriums, so left and right atrium. And then there's also these larger chambers that are more muscular called the ventricles. So this little green dot is going to move around and kind of go through the normal blood flow. So if you start out in the lungs, come back to the left side of the heart, goes into the left atrium, moves into the left ventricle, and then it's going to go out to the rest of the body. And that's going to get blood and nutrients there. Then it comes back through the vena cava, comes back through the atria and ventricle on the right side, and then it's going to go out to the lungs. Then it does it all again. And so if this is functioning normally, we don't have any problems. But if any of these steps, so there are little like valves in between each of the chambers, if there's disease of any of those, then it can certainly wind up being a little bit more problematic. If you're more of a diagram person, again, I try to make it so that it's something that you might be able to kind of visualize. We do have 2 different types of vessels in the body. And so your artery or your pet's artery is going to be where you have more muscle tone. It's where blood pressure is going to be higher. And then your veins are a low blood pressure, and it's kind of what takes blood back to the heart. And so in this diagram over here, you can see that you have blood leaving the left side, winds up going out to the body, and then comes back into the heart, and then goes to the lungs, and then comes back to the heart. And so it's just this constant pumping every time your heart beats. As I mentioned, if blood's going out to the circulation, that's going to be a higher pressure system. So like if you go to your doctor and they tell you they want your blood pressure to be 120/80, that's your blood pressure in your body. The lungs, on the other hand, are a really low pressure system. And so you can see in this little diagram that the blood pressure in the lungs is usually around 25/8. And so if we have diseases like pulmonary hypertension, so high pressure in the lungs, which we have a lot out here in Colorado just because of the elevation changes, then that can also make it hard for a patient to breathe and might need specific therapy. So these are all things that we can kind of investigate in the pre-anesthetic period. The heart has to do 2 things in order to pump, and this is just very basic, but it has to be able to contract to act as a pump to get things to go forward. It also has to allow relaxation to be able to fill with blood for the next heart pump. And so it's important that both of these are functioning well. Dogs tend to have a little bit more trouble or have diseases that affect the ability to contract, whereas cats have a little bit more commonly diseases that affect relaxation of the heart. So you will notice on some of these slides that I have little emblems up in the corner that kind of indicate what species it tends to be more common in. So valvular disease is much more common in dogs and is present in about 50% of veterinary patients, 30% of older dogs, and have a level of mitral valvular regurgitation, which is that leaflet between the or on the left side of the heart that allows for blood to move through it. So if that valve is not coming together like a nice even leaflet, if it's kind of knobbly, like is in this picture, then that can lead to backing up of forward blood flow, and then that can lead to problems that we'll talk about. So if your vet notices a new murmur, so an abnormal sound when they listen with their stethoscope, one of the first things they might recommend would be chest x-rays, which we call radiographs, to evaluate for decompensation, or basically the heart is not functioning well enough to keep things moving forward. If those chest x-rays look good, as far as there's not evidence of congestive heart failure, then kind of the next step is going to be to do preemptively an ultrasound of the heart or the echocardiogram to evaluate for severity of the disease that's present in that patient. Because you can start medications to reduce the risk of complications and slow the progression of the disease. Because like Denise mentioned, we're going for good quality of life, and we want to do everything we can to reduce any chances of them decompensating. You might hear your veterinarian or a cardiologist talk about stages of heart disease. So stage A is basically there's no structural disease, but there is risk of it. The King Charles Spaniels or the Cavies are kind of the poster children for this because they are predisposed to it genetically. Once you start having some structural changes to the heart, not just a leaky valve, then you get into like B2. And then once they go into congestive heart failure, that gets into like stage C. And so this sort of rating system kind of lets us know what the risk is for an anesthetic event. And so patients that are non-clinical but have maybe mild heart disease might be just a low risk, so a class 1, whereas patients that have heart failure, you're not going to want to do an elective procedures. You're not going to do like a dental on these types of patients. If you have a patient that has a non-elective procedure, so say it has a foreign body, or if it's a cat that has a urinary obstruction and needs surgery to fix it, then it would be recommended to go to a facility that does have an anesthesiologist on staff, so that they can oversee that more complex anesthetic event if you have a patient that is also at the same time in heart failure. They're not my favorite to anesthetize, but I do get them through those episodes. So when we think about what are the negative effects of these kind of like knobbly, leaky valves, one of the biggest things is backflow of blood. So if you think back to that initial diagram, blood kind of goes from this left atrium down to the left ventricle. But if this valve doesn't close, so if it doesn't form a nice little seal, then when the heart contracts, some of that blood's going to go back up into this left atrium. When that happens, it increases the amount of volume that's in that heart chamber and starts stretching out the muscle. And so that's also going to change like how hormones regulate blood pressure, because it is sensing like, oh, you're not having enough blood leaving the heart. And so then it's going to increase the amount of fluid the body keeps. And all of this kind of winds up cascading and leading to a dilation or like getting bigger of that cardiac chamber. And then if it gets bad enough, it can lead to congestive heart failure. So that can be where there's fluid in the lungs called pulmonary edema if it's left-sided failure, which is the most common. If it's right-sided, it can lead to abdominal fluid. And so if you have a four-legged friend that does go into congestive heart failure, we treat it with diuretics, so like Lasix, and we give them medications to improve the contraction of the heart because it gets kind of big and floppy and doesn't do its job as well. When any of these patients that have valvular changes, so these little knobbly valves, come in for anesthesia, there's a lot of things that we do on the veterinary side to try to improve outcomes. So one is we try to maintain their heart rate at a higher than typical. So like a normal dog's heart rate, if it's like a little Yorkie or Shih Tzu, is typically around like the 100 to 120 range. So a patient that has mitral valve disease, we might have their heart rate a little bit higher. So we just have some different targets. We try to reduce any drug effects that might increase the workload of the heart. So we're very particular in what drugs we choose, and we titrate it to the patient needs. So if you have a more spicy individual, like some of our older creatures tend to be, then they might have slightly higher anesthetic needs, just to keep them at the same level plane. But we try to use a combination of medications to reduce the negative side effects. We try to reduce stress of handling. And we're also very careful with how much IV fluids we give patients with mitral valve disease, because it is something that we don't want to push them into heart failure either. For our larger canine friends, so large breed dogs tend to get more dilated cardiomyopathy, which basically the heart gets large and floppy. And when that happens, the heart doesn't contract, because think of it like a muscle, just like you would kind of pump your bicep and contract that muscle. If the heart can't do that, it can't push blood forward. And so that can lead to heart failure on both sides of the heart. And this is common in some of our very large breed friends like Great Danes, Dobermans, Wolfhounds, and then Boxers as well. And it can also be caused by an abnormally fast heartbeat. It also has now been linked to dietary deficiency in taurine, which happens with grain-free diets. So I highly recommend that you use a balanced diet to reduce the risk of an acquired dilated cardiomyopathy. So with DCM or dilated cardiomyopathy under anesthesia, our goal is to improve that contraction of the heart. And so we can use a medication called dobutamine to help with blood pressure with that. We're very careful with the amount of fluids we give them. You'll probably notice that's a theme with heart patients. And if they have any abnormal heartbeats, so a faster than normal rhythm, we can also give directed medications to treat that. And so that's where getting that ultrasound of the heart, the echo, before an anesthetic event, so you know exactly what kind of disease you're dealing with. You can optimize management before you put them under anesthesia. It makes their risk a whole lot less. We try to avoid certain sedatives, so things like alpha-2s, which one of the most common is dexmedetomidine. Great for healthy hearts, not very good for hearts that have disease. And so we try to avoid those. We avoid high doses of ketamine. We avoid a particular anesthetic called etomidate, because there was this paper that came out, now it's been a while ago, but in 1998, that actually showed, even though it's supposed to be a cardiac friendly drug with DCM, it actually reduces the function of the heart. And so again, we're titrating to the patient needs. We're considering what drugs we're going to choose and just being very purposeful in our choice. We don't want to leave out our feline friends. I have 2 cats at home of my own, but as cats age, they tend to get a disease called hypertrophic cardiomyopathy, or HCM. Remember, we talked about the dogs, they have more trouble with the contraction. Cats, they have a little bit more trouble with the relaxation phase of the heart working. And so when their heart doesn't relax like it should, it doesn't fill back up with blood like it should. And that can lead to blood kind of building up in this atria. It starts to dilate that. And over time, that can also lead to inappropriate clot formation. So having like a thromboembolic event. This is an inherited disease, but it can also be induced by elevated thyroid hormone. And so optimizing hyperthyroid management, and also making sure that they're being treated for their hypertrophic cardiomyopathy if it's there, that will help to make that anesthetic event a little bit smoother. So our goals with cats with HCM are very different from dogs with mitral valve disease, because the dogs, we wanted to keep like a high normal heart rate, but cats with HCM, we want them to spend more time with their heart relaxing. So we actually want their heart rate a little bit lower. We want to reduce any of their stress and have a well-balanced anesthesia, make sure we have pain management, local blocks, and give them what they need to be comfortable and asleep. And we want to make sure that we're optimizing their heart rate. So some cats on with HCM will be on a medication called atenolol, which is a beta blocker to slow down the heart. You can probably appreciate in this echo image that, so anything that, and this is the ultrasound of the heart, anything that's black is like fluid filled. And then this kind of modeled look is actually that thickness of the heart. And you can probably appreciate, even though you haven't ever looked at an echo before, that there's not a whole lot of like blood volume within the heart, but then the heart itself is really thick. And so that's where the ultrasound of the heart with a cardiologist really helps with being able to determine the severity of disease and what needs to be done. When these patients are under anesthesia with HCM, we avoid using drugs like ketamine, because that can make them more predisposed to an elevated heart rate and can actually be problematic. And so we just try to avoid it with HCM cats. We try to avoid certain sedatives like that dexmedetomidine because it does increase the work of the heart. And we just try to reduce stress of handling. So, I mean, 30 years ago, it was pretty common that to start anesthesia, patients were put into like a chamber with inhaled anesthetics and then eventually went to sleep with that. But it's been found that that's a lot more stressful. So using injectable anesthetics to get them to the point that they'll allow us to put a tube in their airway and protect their lungs is a lot less stressful. And then we started inhalants at that point. So that's kind of the common cardiac diseases. And so we're going to move on to blood pressure and kidney challenges. Just like with humans, that we can get primary high blood pressure or hypertension, and we can get kidney disease as well. Our veterinary friends can too. So again, I try to go a little bit into the physiology just so that you can understand why we care so much about it. And so I think of the kidneys as kind of a cranky organ. They like having a set amount of blood flow to keep them happy. And so there is this area that the body is really smart and keeps adequate blood flow to the kidneys to make them happy. And so usually that's at a blood pressure between 80 and like 160. But if we get below that, or if we get above that, we can injure the kidneys further. And so we really care about like what their blood pressure is doing because we want to make sure that kidneys stay happy. They do a lot for the body. So if you have a patient that has high blood pressure, so systemic hypertension, which can be caused due to hormonal imbalances like elevated cortisol, diabetes, or elevated thyroid hormone, or can just occur as a primary problem, we need to know that ahead of time. And why that's important is that autoregulation, so where the kidneys are happy, because we want to keep the kidneys happy, gets kind of pushed over. It gets a new set point. So if you have a patient that has a chronically high blood pressure, then we're used to, or that kidney is used to getting a lot more blood flow. And so with that, we always get our baseline blood pressure and then stay within 20% of that baseline because that zone of autoregulation is just shifted over. It's really important to reduce any spikes in blood pressure, so low stress handling, give them multiple drugs that have pain relieving properties. And so multimodal pain relief is really important. We don't want to give them medications that are going to further increase their blood pressure. And so that would be like the sedatives, the alpha 2s, and dissociatives as well. So drug choice winds up being really important. In the lungs, because remember we talked about that the systemic blood pressure will be 120/80, and then the pulmonary blood pressure is like 25/8. And so if there is an increase of that pressure within the lungs, that can also lead to respiratory changes and make it hard for them to get oxygen into their body. It's really common in dogs that have primary lung disease. So like the toy breed and small breed dogs have a lot of collapsing trachea. They can, like Westies can get fibrosis in their lungs or like scar tissue basically. Or if you go from sea level up to like Vale at 12 or 15,000 feet, that change in pressure can also induce pulmonary hypertension. I'm just gonna take a quick drink. And so this can make it difficult for patients to breathe. They might develop a new cough, be pretty lethargic, and they can go into heart failure just from high pressure in the lungs as well. And so this is something that's also diagnosed on an ultrasound of the heart to determine, is it primary heart or is it due to increased pressure in the lungs that's causing coughing and these other changes. Nice thing is that we do have medications like sildenafil that can be given orally to manage elevated pressure in the lungs. Oxygen's actually really helpful for reducing that pressure. And so we always put oxygen on them before we make them go to sleep under anesthesia and keep them on 100% of oxygen as well. And then we're trying to make sure they stay well oxygenated, that they're breathing normally, they don't get light, they stay at a comfortable body temperature. So we're just trying to like manage all these things together. Aside from just pressure changes, we also know that the kidneys are a really important organ. And so remember with the kidneys, In humans, have the luxury, if a patient goes into renal or kidney failure, that we can frequently do dialysis to make them more stable. That does wind up being cost prohibitive, and so in veterinary medicine. And so we have to really consider all the functions that the kidney does, and how we can optimize the management chronically. So the kidneys are important for getting rid of waste from the body. So they help us to get rid of anything that is like a byproduct of the cells doing what they need to do to keep an animal alive. The kidneys also produce hormones that create red blood cells, which is important for oxygen carrying. They secrete tons of hormones that help to regulate the volume of blood in the body, whether it's within the vessels or the fluid volume outside of the vessels. It helps with electrolyte balances and the concentrations of different items in the blood, and also like pH balance. So this is just an overview. This is for one of my boards. I like put together everything the kidney. So it's an extremely complex organ. And so it's a lot that we have to think about. It does a lot for the body. And so it actually gets about a fifth of the blood flow. So for its size, it gets a ton of blood flow, about 22% from the heart. And so when the kidneys are doing that, doing their job, they're getting enough blood flow. We want to maintain that under anesthesia because, again, we don't want them to get upset. We want to keep them in this autoregulatory zone where it has enough blood flow, enough pressure to be able to continue doing the job that it needs to do. Compared to the brain, the kidney actually gets 7 times the amount of blood flow and utilizes 2 times the amount of oxygen. And so it really needs to have that continuous amount of blood flow and pressure to it so that it can continue to do its job. Some patients will have chronic kidney disease and also have an elevated blood pressure. And so this purple line that's the one in that the cursor is kind of over now, it basically shows that there's a smaller zone of that autoregulation where blood's going where it needs to. So we have a very tight control under anesthesia where we're making sure that that blood pressure stays in that happy zone. Unfortunately, kidneys don't tell us when they're sick early. And so oftentimes you'll have your family vet recommend doing lab work and a urine analysis to evaluate for organ function. Unfortunately, you have to have a patient that's lost over 60% of the ability to concentrate urine, or 60% dysfunction before you lose the ability to concentrate urine. And so it's a good screening test, but that's a lot of the kidney to not work right before we actually see an elevation. And before we see an elevation of kidney values themselves, you have to have 3/4 dysfunction of the kidney. And so it's great that they have that amount of reserve, but it doesn't let us know too much ahead of time. If you're more of a visual person, so one of the values that we look at is creatinine. Normal is usually below 1.5. You can see the blood flow to the kidneys, which is this GFR, stays pretty high and then greatly reduces when all of a sudden you have an elevation of that kidney value. And so it's kind of this holy grail where we're always trying to figure out exactly how we can identify this sooner, but we just haven't gotten to a point that we can do that yet. But there's a lot of really smart people trying to come up with earlier markers of decreased kidney function. So you can have chronic kidney disease, but you can also have an acute kidney injury. And what happens if the kidney suddenly gets injured, which can occur when there's lower blood pressure flow, is that it initiates a change in the cells and they kind of die off. And as long as you have that basement or like the basically ground floor of the kidneys is not affected, that kidney can recover from an acute kidney injury. But the best way to go about reducing this risk of injury is to be preemptive about it. So that's where we watch our blood pressure really closely, make sure that patients are well hydrated, and really just try to protect the kidney as much as we can. You might see, if you're somebody that does a lot of Google searching that if you're looking into kidney injury, there's a couple of different ways of classifying this. There's the rifle classification where a patient might be at risk versus are they actually in renal failure. There's also these others like the Akin network that just kind of has it in stages based on that kidney value, the creatinine value. It's a little bit different with chronic kidney disease, and sometimes we can get acute on chronic. But with chronic kidney disease, we watch the creatinine, which is that value that if 75% of the function is lost in the kidney goes up. So that's one of the things we're going to watch serially in patients. One of those biomarkers I mentioned is SDMA. And so we are finding that it goes up before kidney values actually go up. And so you might have a veterinarian that, if you're screening for early chronic kidney disease, recommends doing that or another biomarker. Any patient that's undergoing anesthesia that has chronic kidney disease, we're going to look at how well hydrated they are, because the kidneys like having enough hydration in the body to be happy. We're going to look for systemic high blood pressure and get a baseline blood pressure. We're going to recommend doing a complete blood count and a chemistry panel and look at electrolytes. And then also look at other things. So is their heart normal? Is their pH normal? Do they have any other health problems of note? And so we're going to do a total evaluation, which might require some lab work submission and other diagnostics. With patients that have renal disease that are under anesthesia, again, we try to minimize stress, because we don't want to have those stress hormones suddenly surging and reducing blood flow to the kidneys. We also want to minimize anesthetic time, so making sure everything is set up, have a nice fast surgeon, and maintain that blood pressure so it doesn't drop below 20% of that normal. If there's a patient that has an acute kidney injury, it might be something that we rapidly rehydrate them in hospital. And so if you have a patient that, like, your dog was normal yesterday and then has been vomiting because it had a foreign body and it got really dehydrated, before it undergoes anesthesia, we're going to get them better hydrated with intravenous fluids before we put them under anesthesia. So we run a lower risk of injuring their kidneys. If it's emergent and we don't have time to rehydrate, then we might try to push them a little bit quicker, over a few hours, up to 6. But that's also provided their heart can handle it, because some patients also have heart disease. And so we can't push them that much with IV fluids, because we don't want to push them into heart failure either. We're always going to look at electrolytes and make sure potassium especially is normal, because that can make them more predisposed to abnormal heartbeats. And usually if their kidneys hurt, then they're nauseous. So we give anti-nausea medications. They can be more prone to gastrointestinal ulcers. So we'll give an antacid, and it can be uncomfortable. So we also give pain meds. With chronic kidney disease itself, if we have a patient that we know is going to have an elective procedure, we typically will try to get them on either IV fluids in hospital or sub-Q fluids at home prior to the anesthetic event. Again, giving them the best possible option of being as hydrated as they can be before they undergo anesthesia. We're going to make sure we don't push them too far and push them into heart failure. We're going to watch their baseline blood pressure and make sure that we stay at an appropriate level. If it's a patient that's been put on an antihypertensive like amlodipine, we're going to make sure that we keep that going as well, because high blood pressure can also injure the kidneys. With chronic kidney disease, often the potassium can actually be low, and so we will typically have to supplement, versus acute kidney injury, it'll actually be high. And same types of supportive things, because when you have kidney disease, then it often makes you prone to nausea, GI ulcerations, and discomfort. Sometimes, depending on the severity of disease, we might need to consider some reduction of drug dosing. So your vet might talk to you about doing either dose reduction or interval reduction of some more potent pain medications, because the kidneys often are what's going to allow for those drugs to leave the body. And so if they're not functioning as well, then the drugs are going to last a little bit longer. We want to watch how much volume they're taking in and how much is coming out of their body in urine. And then just make sure we continue with supportive care in the post-op period as well. Just a little note on post-op care. So I know a lot of people express concern about using non-steroidal anti-inflammatories in patients that have chronic kidney disease. The thing is that NSAIDs are really good for pain management related to inflammation. So if it's a surgical cause that doesn't go into the GI tract, it can actually be really helpful. There's also drugs like acetaminophen that can be used safely in dogs, and it's a central NSAID at low doses for a short amount of time that can also be helpful in some instances. However, in cats, acetaminophen is a no-go because it can actually make it so that their red blood cells get damaged. And so it's very important to consider what patient is being worked with and ensure that we're choosing the appropriate pain management for them. Actually, out of North Carolina State University, there is a lot of research happening about chronic NSAID use, especially in cats with chronic kidney disease. And Duncan LaSalle has kind of been the one that's been spearheading this. But at reduced doses, it's actually been very effective to use Onsior, meloxicam, and others comfortably with chronic kidney disease patients that also have like osteoarthritis pain. So just because there's chronic kidney disease doesn't mean that there's not options for chronic pain management. The last kind of big thing to cover is hormonal imbalances. And so this is going to be things like insulin, so like diabetes mellitus, thyroid imbalances like hypothyroidism and hyperthyroidism, and then Cushing's in dogs. So diabetes mellitus is a decreased insulin activity. So in most instances, it's that their body is not producing enough insulin. And insulin is really important for maintaining appropriate blood sugar levels, but also energy like creation in the body. So without insulin, then they get into a negative energy balance and it can cause a lot of problems. So ideally, before an anesthetic event, you want to get their diabetes really well managed. And so you want them to be at a steady state because they can lose a lot more fluid if their blood sugar is too high, because they create a lot more urine. And then they're also not utilizing energy appropriately. It can make them more predisposed to other complications. If they are in a crisis, so like a diabetic ketoacidosis, then it can lead to really profound dehydration, make them very unstable with some electrolyte problems, so like abnormal potassium and sodium. Their blood sugar can get dangerously high. So normal's around 100, and the highest I've seen is in the almost 800s. But also if they have an insulin overdose, it can go way too low and also be life-threatening. So we try not to anesthetize patients that are in a dysregulated state or in a crisis because it just makes them automatically a lot more critical. So with patients that have well-controlled stable diabetes, we always recommend that they be scheduled for the first procedure of the day and be fasted after midnight, so no food. They can still have access to water. And then as soon as they arrive at the clinic, check a blood sugar on them to see if they need any insulin. And so this is something the vet has to decide, but if their blood sugar is too low, so less than 100, then they don't get any insulin that day. And then if it's a little bit higher, then we might go ahead and give a quarter or a half dose, and then we might have more aggressive therapy if their blood sugar is sky high. And so things that you might hear a vet talk to you about using would be like giving some dextrose or blood sugar if their blood sugar is too low, or giving a short-acting insulin like Humulin R if their blood sugar is dangerously high. And so we typically try to maintain their blood sugar in the high 100s to low 200s, or around where their normal is. So some dogs and cats are kind of their normal is in like the low 300s, and we're going to aim for that. And we're going to monitor it throughout the anesthetic event because we just want them to stay in that happy range. If they persistently have an elevated blood sugar, again, we might consider giving a short-acting insulin or regular insulin. And if their blood sugar gets too low, then we can supplement that IV. So my big thing is if you don't look, you don't know. So we always just monitor and watch pretty closely. In cats in particular, one of the clinical signs we'll often see is these like dropped hocks where their back legs are just kind of like flat on the ground. So that's very common. And so in cats, especially, we'll have that as part of our physical exam screening if we need to consider doing a further workup. When these patients are under anesthesia, we monitor their fluid balance and hydration status really closely, minimize any stress with handling because stress hormones increase blood sugar as well. And we avoid certain sedatives that are going to increase the blood sugar too. And then we look at what other health conditions they have and take those into account as well. Dogs can also get a disease called hyperadrenocorticism or Cushing's. And so this is where there's too much steroid hormone production. There are a lot of different causes, but typically it's due to the adrenal glands producing too much of the steroid hormone. This is a very stereotypical appearance of a dog that has unregulated Cushing. So they have this kind of pot-bellied appearance. So they kind of lose that abdominal tuck. Their hair coat gets a little bit patchy where they have some hair loss. They often drink a lot, urinate a lot, and eat a lot as well. They could also be predisposed to other diseases like kidney disease and diabetes. And so we always screen for those as well. They can also be prone to elevated blood pressure, which I'll mention in a second. Their liver enzymes are typically elevated. They often cannot concentrate their urine, and they can form inappropriate clots. And so these are all things that we kind of screen for ahead of time. We watch their blood pressure closely because just like we talked about earlier, if the kidneys get used to having a higher blood pressure, and then it can be problematic if their blood pressure drops below kind of their normal range. Oftentimes, these patients are chronically put on an ACE inhibitor, which is a medication like enalapril or bedazopril to reduce the chronic effects of this high blood pressure at the level of the kidneys. But it's highly recommended to not administer this the day of anesthesia because it does lower the blood pressure, and then it has an additive effect with the anesthetics. It can make it really hard to get their blood pressure normal. And so that's something that's one of those drugs that you'll be requested. Please don't give this medication the day of anesthesia. We also monitor them closely for excessive bleeding, especially if they're on medication for forming inappropriate clots. So that would be like clopidogrel or Plavix. And so if your pet is scheduled for a surgical procedure, so something that's going to be taking out a tooth, taking off a mass, anything like that, and they are on Plavix or clopidogrel, it actually binds irreversibly to the platelet, so it makes it less functional. And so we recommend having a week before surgery where they're not on that medication so that their platelets can be replaced in their body and actually function when you do surgery. We also watch their sodium levels really closely because they can get quite high with Cushing's disease if they don't have access to water. And so that's going to be part of the pre-anesthetic check as well. Under anesthesia, we tend to choose reversible or short acting drugs and also consider what other diseases they have happening. In dogs, mixing steroids and non-steroidal anti-inflammatories makes them at a high risk of ulcerating or even perforating their gastrointestinal tract. And so in patients that have uncontrolled Cushing's, we will not use an NSAID just because it's not worth that risk. Sometimes their muscles don't work as well as we'd want them to, and especially the muscles of breathing can get really tired really fast in patients that have Cushing's disease. So we'll typically assist them by breathing for them. And then in recovery, because they are more prone to thromboembolic events, especially if they've been discontinued off of that antiplatelet medication, we watch them for any trouble breathing, collapse, blue mucous membranes, or any concern for decompensation. And so the last kind of set of like hormonal things is hyperthyroidism. So cats are kind of the poster children for this, but dogs can also get it. And so hyperthyroidism is due to an increase in the thyroid hormone production. So the stereotypical like things we might find on physical exam is that they'll be pretty thin. They might have an elevated blood pressure, elevated heart rate. Their kidney values could also be elevated, and they can have an induced hypertrophic cardiomyopathy from this metabolic hormone excess. So this is kind of like a stereotypical look of a cat that has unregulated hyperthyroidism. And so minimizing stress is like of the utmost importance. Drugs like acepromazine, which is a sedative, can actually lower blood pressure, so can be helpful. Using benzodiazepines like midazolam or Valium can be potentially helpful. Using opioids to manage pain, and then using cardiac-friendly sedatives like intramuscular alfaxolone can all be really helpful. We try to avoid any medications that it can increase heart rate because they do typically have, at the same time, hypertrophic cardiomyopathy and use more oxygen because of that thickening of the heart muscle. So we just try to keep their heart rate kind of a low normal. With that, we avoid using ketamine in these guys, and we make sure that they don't get light under anesthesia. So using multiple medications that keep them asleep and comfortable, local blocks, and just trying to minimize any stress with them. In general, if they're having a crisis or like a thyroid storm, we're not going to anesthetize them, but it is something in that intake physical exam that'll be evaluated very closely. So looking for an elevated heart rate, elevated blood pressure, look at the heart rate and rhythm on an EKG to look at that electrical activity in the heart, check their body temperature, make sure that's normal, blood pressure to make sure that they're perfusing okay. So we do want to screen for that. In general, we try not to palpate the thyroid gland, which is right like on the neck, excessively, because that can actually induce it to release more hormones. Canine thyroid tumors can produce thyroid hormone, but it's like less than 5% actually do, and most of them are non-functional. However, canine thyroid tumors do tend to be a little bit bigger. So if you have an older pet that has a thyroid tumor that's being removed, then you can kind of see this large swelling that's on the neck. So that's its little tongue, and its tail is that way. And so this can actually compress the airway because it's right around the trachea. So that airway can be a little bit smaller. So sometimes we'll have to use a smaller airway tube or use other devices to be able to safely intubate them. There's also this other little gland right next to the thyroid called the parathyroid that's important for calcium metabolism and management in the body. And sometimes when the thyroid gland has to come out, then the parathyroid also comes out. And so sometimes we'll have to watch their calcium levels really closely. Dogs more commonly will get hypothyroidism, so too low of thyroid hormone. It's usually due to an immune-mediated destruction of the thyroid gland itself. And so what we can wind up seeing is that they can get recurrent skin infections, weight gain, hair loss. You can kind of see in the Sheltie that she just has like a patchy hair coat. They can have some nerve changes that slows nerve conduction. So sometimes they can affect the larynx and cause like laryngeal paralysis, or can have a dilation of their esophagus, so megaesophagus. And so those are all things that we kind of screen for in initial workup. Sometimes we'll do lab work and wind up finding that their cholesterol and their triglycerides are really high, but their red blood cell count is low, and then their thyroid hormone is almost like non-existent. And so this is one that, I mean, everybody wants nicer skin and to lose weight. So we always joke around like it's the easiest thing to treat for hypothyroidism. You can give them levothyroxine and get them pretty well managed. But certainly if they're in a crisis, we're also going to try to not anesthetize them. And so this is something called mixed edema coma. And with that, with a lack of, or an absolute lack of thyroid hormone, then blood pressure gets really low, the heart rate gets really low, and you have patients that are just not very conscious, and we'll see if this video wants to work. So this dog is not on any sedatives, but its thyroid hormone was not readable, and so is minimally rousable. We actually wound up giving injectable thyroid hormone to this creature, and within 12 hours was up walking around and wagging its tail. And so there's certainly going to be those crisis situations that are more rare, but you don't want to anesthetize patients in that state. So levothyroxine is typically the hormone replacement that is given. It's not detrimental if it's not given the morning of your patient's anesthetic procedure, but it can be helpful to like just go ahead and keep them well regulated, get it to them that morning, because without having that well regulated, they have a lower metabolism of drugs. They might be harder to keep at a normal body temperature. And so we're just going to consider that in our drug choice, use lower drug doses and titrate to what they need. So all of this is a lot of information to give you some background, but I find that usually then the question is, well, what do I need to do? And so in general, for preparation for any anesthetic procedure, going to your family veterinarian and performing a health evaluation. They may recommend doing lab work, chest x-rays, or may recommend you go see a specialist, like an internal medicine specialist for kidney disease or blood pressure disease, or a cardiologist for concerns with the heart. In some instances, we may even recommend that even with stabilizing those chronic health conditions prior to elective procedures, it may still be better to have an anesthesiologist oversee it. And so looking into options in your area for that. It's also important that you fast, so not feed patients after midnight, but make sure they have water available at all times. This reduces the risk of them wanting to vomit, which could lead to aspiration problems, and that's true of any patient. And then in general, we recommend giving normal medications the morning of the procedure. And so I just kind of wanted to review some common things that were like, yes, please go ahead and give that to the patient the morning of surgery or anesthesia. So Femobendin or Vetmedin, which helps with heart contraction, as well as any diuretics like furosemide or Lasix, spironolactone, things that are going to manage the heart rate. So atenolol, which slows the heart, or antiarrhythmics like sotalol, mexiletine, and diltiazem are all important things to consider. If you have a patient that's on a drug like amlodipine for blood pressure management, amlodipine mildly lowers the blood pressure, so it keeps those kidneys a little bit happier. That should be given as well. And hormones like methimazole for treatment of hyperthyroidism or levothyroxine for treatment of hypothyroidism, those should be given in the morning as well. But there's also some that can make anesthesia and blood pressure management a little bit more challenging. And so I typically recommend not giving ACE inhibitors like benazepril or enalapril the morning of anesthesia because it can make their blood pressure really low. There's some newer drugs for blood pressure management like telmisartan, which actually has a super long activity level in the body. And so for those patients that have maybe seen an internist and are on that for like a protein losing kidney disease, then I'll recommend stopping it 2 to 3 days before the anesthetic event. And also if they're on something like Plavix, that's going to help with reducing inappropriate clot formation. If they're having a surgical procedure, they should be off of that for 7 days. For hormones with insulin, I always recommend not giving insulin the morning of anesthesia, but bringing your insulin with you to the vet so that if they need to give something longer acting than the short acting regular insulin, they can give the typical insulin, whether that's Vetselin or Glargine or whatever you're using on your patient. So I really appreciate you guys' attention, and I have a few minutes that I can try to entertain any questions for you guys. So thank you so much.
Awesome. Thank you so much, Dr. Trenholme. I know that was about anesthesia, but it really gave us a good biology reminder or lesson in how the heart works and the kidney work. And I think it's just refreshing to know that there are so many things our veterinarians look for depending on our pet's condition so that they can monitor and manage those things during anesthesia. But we do have a couple of questions here. Kathy wants to know, Kathy is saying, I always have trouble deciding on doing a dental on a geriatric dog if it isn't serious, like an abscess or extreme pain or broken tooth. Yet I know it's important to control periodontal disease and kidney or heart problems. How do you decide?
I think that's a lot of discussion with your veterinarian and you on deciding what's going to be best for that patient. I will say, like, if you wait until it gets to the point where there's a bunch of abscesses or cats that have a lot of resorptive lesions, that's going to make that anesthetic event a lot longer and more complicated. It's going to be a lot more painful stimulation. So they're going to need to be a little bit deeper. And so it's kind of the old adage of an ounce of prevention is better than like a pound of cure. That if it's something that you can do more regular dental cleanings, that you might only have 1 or 2 extractions versus waiting until they're really painful and then they have a terrible infection. I think in the long run, it has the potential of improving outcome because you won't have as long of an anesthetic event and they'll be more comfortable. But I think that's definitely a personal decision between you and your family vet.
Thank you for that one. Roberta is asking, her foster dog is actually having a Cushing's test tomorrow. What does that entail?
Yeah, so Cushing, so that's that elevated cortisol hormone, is typically what they wind up doing is they do a series of blood draws. And so the most common one is called an ACTH stimulation test, where they will take a baseline blood sample and then give cositropin, which is a hormone, to try to induce more steroid hormone production, and then take a post sample. There's also something called like a low dose dex suppression test, which is like an 8-hour test. And so they get a baseline sample, then they give actually steroid as an injection. And then in a normal dog, that should make it so that their body doesn't produce more of that hormone. But if they have too much production, like if they are cushingoid, then those values will be high despite the fact that you gave an injection of an exogenous steroid. So there's a couple of different tests out there, but it's usually a series of blood draws. And then based on that information, it may be recommended to have an abdominal ultrasound to look to see, is it a tumor that is in the adrenal gland that we might need to consider removing because it's a little bit more scary? Or is it something that there's just like bigger adrenal glands than normal and not too big of a deal? So there's kind of different levels of testing, if you will.
Very helpful. And I know you have a lot of animals to go take care of. So, one last question from Terry. Is a condition of fat around the heart dangerous for anesthesia in a senior dog? And if so, how dangerous is this condition in relation to anesthesia?
Yeah, so when we love our patients or our pets, we tend to love them with food. I know you were talking about your Akita earlier and how there may be a little bit too much love when you adopted them. And so one of the places that dogs will put fat is around their heart or pericardial fat. It's not too much of an issue. It's not the same thing as like humans. They'll talk about clogged arteries. So that's like when lipid or fat winds up being in the actual arteries in humans. And that can happen in birds and in primates, so like gorillas. But in dogs and cats, they tend to deposit the fat around the heart, and it doesn't typically affect them, as other than the fact that if they are obese, then it can make things like breathing a little more challenging, put more stress and strain on their joints. But the actual little fat pad around the heart, not a problem. There's rare instances where some dogs have like an elevated triglyceride level in their blood that can make them more prone to like stereotypical heart attack type signs, but just a little extra fat around the heart itself is not typically a problem.
Well, I hope that can make Terry breathe a sigh of relief. Thank you so much, Dr. Trenholme, for an excellent webinar. And thank you to all of you who attend our monthly public webinars to help you better help your pet. As you may know, Gray Muzzle Organization gives grants to shelters and rescues all over the country and beyond for specifically for senior dog programs. And this last year, we gave out almost $850,000 to 90 shelters and rescues. So we couldn't do this without you. Thank you for your support. And our next webinar will be on December 6th at 2 p.m. Eastern Standard Time on heart disease and your senior pet. Thank you again, Dr. Trenholme, and thank you to all of you for helping us to help our older best friends.
Thanks, Denise. Thank you guys for having me.
My pleasure.